Thanks, Faye. Thank you. And good afternoon, everyone. I'm Ali Bolton, and the emoji that you can see on screen very obviously looks exactly like me, potentially about 30 years younger, I have to say, but still. So today I'm going to talk to you about solving system stuff and how the organisations within our foundation group have worked across health and social care to resolve issues during and beyond COVID. A little bit about me before we dive in. So I'm the Associate Director of Improvement at Wye Valley, at South Warwickshire Foundation Trust and at George Eliot Hospital NHS Trust. So I spend time, or I did pre-COVID, in each of our organisations, kind of ramping up the kind of improvement movement and getting people excited about the things that we can make a difference to. I joined the NHS in 1995 as a part-time specimen receptionist. Fast forward 25 years and a variety of jobs and a sprinkling of education later, and here I am. And I had been in this role for 12 months before COVID stepped in and ripped the rug out from under me in the same way that it has to most of us. So pre-COVID, my role was very much around continuous quality and service improvement and delivering education at an STP level and across our foundation group. I also spent a lot of time networking and joining dots up behind the scenes. So when people said to me, "Oh, Ali, I'm doing a project on falls," for example, I would be recommending that they speak to our colleagues across the foundation group to see if there's any work that's been undertaken that was of a similar vein, so that we weren't duplicating effort and were making the best of the resources that we had available to us. The flag that you can see on screen there is the CUSA curriculum, which I'm heavily involved in. So a big shout out to any CUSA faculty members that are with us today. Now, COVID stepped in and my day job kind of ground to a halt. And I know the same happened to others. But in conversation with our chief operating officer, I was quickly redeployed to developing staff wellbeing hubs, and we stood 6 of those up across the county for our staff to kind of gain and benefit from the sort of support that was being offered. I was also managing the crazy volume of donations that were coming in on a daily basis. And I don't know about you guys, but I was utterly overwhelmed by the volume of Easter eggs that we received. And there are still 1 or 2 under the desk here, but let's not talk about that. The other thing that happened during this period is that we put a sign on our office door, and it's still there, and it reads "Solutions are us." Um, and This is very much about the at the time, the world felt incredibly hairy, didn't it? It was exciting and nerve-wracking, kind of exhilarating and exhausting, and we didn't know what was going to walk through the door next. It genuinely did feel a little bit like the Wild West. And because the people that sit in the room that I'm in this office, we're all program and project types. So we'd got kind of activity and projects coming out of our ears, and it was a really buzzy time, but it was all moving at breakneck speed. And it's the solutions are us part of this scenario that I'm gonna share a couple of stories with you about today. So the first story that I will share is our partners, South Warwickshire and George Eliot Hospital, and their partners in their STP and across their places. And the second story is from Wye Valley and the work that we did here with our care homes. Now you'll see on screen. I've bundled our logos together with lots of other logos from across our individual patches. And um, this is about the fact that we don't do anything in isolation, do we? Or we haven't done through COVID. We've pooled resources and we have worked together, all pulling in the same direction. We simply didn't have time for all the old niggles and tensions. This pulling together was basically the only game in town. So we had to play nicely together. And I'm fairly confident that this scenario played out across the country. I don't think it's peculiar to our organisations or our foundation group. But it's fascinating the development of the relationships that happened during this time, and the continuation and strength of those relationships. So, my first story then, I will hands up say this is a story that has been shared with me from South Warwickshire and George Eliot. So, I wasn't a part of this project because I haven't been able to visit them and be a part of it. But great story nonetheless. So this is about Discharge to assess and what happened to the work that they were doing over there during COVID. You can see they had a strong model in place to take Discharge to assess forward. So they had a leadership system. They were following guidance. They had a joint approach at both system and place level, and were very focused, obviously, on the outcomes for patients and customers and the wider benefits to the system. So in comes COVID, and very quickly the leadership across Warwickshire came together to join forces. Um, they were already well established as a group, although there was some imbalance with the market as it stood. They the team themselves, when they came together very quickly, decided on roles and responsibilities within the team, alongside the joint decision making process, so that things could move at pace and as smoothly as possible. So again, this wasn't a group of people that had suddenly been thrown together. There was a relationship there. Their drive and desire to deliver a home first approach to Discharge to assess was made all the more crucial with COVID nipping at their heels. Their ability to coordinate at system level alongside place-based delivery gave them a real opportunity to make this work fly when they needed it most. And this next section describes the things that they put into place to enable this project to really make a difference. So putting a single point of contact for patients in place reduced the anxiety for patients and their families, and gave the patients the opportunity to ask those questions that maybe hadn't been asked at the point of discharge. It also gave them that kind of security blanket. So we were driving people through our systems at pace. We didn't want anybody in an acute environment that really didn't need to be there, with all the potential for infection attached to that. In discharging people at pace, I guess there were questions that they had that weren't necessarily answered kind of up front, and opening the door with that single point of contact really helped patients to kind of settle back into kind of their daily lives. Because these patients, because the patients who were being put through the discharge to assess process were often frail and elderly, there was dedicated enhanced frailty support made available for them. Someone who genuinely understood frailty as an issue, and how to kind of make the best of what they had available to them. Community beds across the system were also repurposed at this point, and used to provide isolation beds, so enabling patients to be cared for again outside of an acute setting, while not spreading the infection to their family and friends. A great use of a resource that was really not being well used during the first wave of COVID. All the organisations involved in this had staff that were redeployed at the time as well. And so from across the system, many of these guys were focused on providing a smooth and safe discharge from hospital. And all of this genuinely resulted in a reduction in care home admissions, and I will share some data with you around that in a second. But these are just some headlines that people offered to the team, kind of during and beyond the setup of this service. So it's not about integrated hierarchy. It's not about integrated staff. It is about integrated delivery. I think that is just glorious. I love it. And it's an honest, open conversation, and people are not trying to control the whole system. Absolutely crucial at that moment in time that everyone was pulling in the same direction, and everyone was comfortable with having kind of views heard and shared and challenged as well. People became much more like a family in this environment, so we can fall out with our families and move on and get over it, can't we? And there was some of that at play here. And that last quote there, with good relationships and good data, you can rule the world. So let me share this data with you so that you can see the difference that this work has made. So the chart on the left of the screen there describes the average length of stay for over 75s, and you can see there was a significant dip and a sustained dip in the length of stay for patients who were over 75, and that dip was by nearly 4 days, and it has been sustained for a long period of time now. That is now our new norm. That is the level to which we are kind of driving this change. And then we've got the care home weekly hours as a snapshot. You can see there's kind of a stratospheric rise in the need for home care hours, which would correspond with us sending elderly patients home. They need that support in their own home. And then to kind of top the data charts here, we've got the care home admissions. Now you can see there's a long run of years there along the bottom of that chart, but the reduction in care home admissions was sustained and driven further down by this activity. So a brilliant piece of work that has made a lot of difference to the people and the staff in Warwickshire. So my second story, and this is from Herefordshire, and I was involved in this piece of work. So we have the care home crisis, and it's creeping, isn't it? It's we could feel it coming. We knew there was pressure in the system, and the media coverage alone was kind of terrifying to a certain extent. And as a system, we absolutely were feeling the impact of the demands that we were having from care homes. Uh, as a leadership team, it was absolutely recognised that there was a need for a multi-agency response to this crisis, so we introduced daily huddles, and all the organisations there were a part of those daily huddles. And the things that were always discussed in the huddles were it's around the coordination, the knowledge, information, and how to negotiate our way through this. But the understanding around each of these homes was very much it was kind of the nuts and bolts of the piece. So who was the owner of the home? How many residents are in the home? how many staff work there, what was the layout of the home, and what sort of patients were in the residence. Were there any condition specific? Were there any patients with dementia? This is all the sort of information that we needed up front to allow us to help these guys with this creeping crisis. There was also a huge amount of information that we needed to extract from each of the homes, not least how many positive COVID cases have you got in both staff and residents, how many suspected, how many deaths have you had. And the information flow was really interesting. We had a really frank conversation with care home managers very early on in the process, and in essence, they told us that we were kind of driving them all nuts because of the volume of phone calls that they were receiving on a daily basis. Asking for information, and because all of the organisations that were involved in this huddle were all calling them and asking them for something a little bit different. So you can imagine the volume of calls was creeping up. And what these guys were saying was that, you're taking us away from the needs of our clients. We can't focus on our day job because we're busy tearing around trying to get information for you. So we developed really quickly and a central checklist that we could all work from. That meant we had just 1 or 2 phone calls a day going into the homes. It was held centrally and accessed by those that needed it. The negotiation element of the conversations that we had was very much around the fact that the care homes were often privately owned. They had a manager. And what we didn't want to do was to go into the homes in a heavy handed way. We genuinely wanted to go in and offer support and advice and guidance as opposed to a heavy handed intervention. We focused on the homes that were the hardest hit, and we in the first instance we sent 2 very experienced senior nurses into each home to offer that support. Support and reassurance was at the top of our agenda. We had to remind ourselves as well that these guys didn't have the weight of support wrapped around them that we in an acute setting would. So they don't have an infection prevention team. They don't have a health and safety team. They haven't got someone managing their logistics and PPE. And nor have they got really easy access to medical or nursing advice. And in going in, the support and reassurance wasn't just around the patients. We were really keen to understand whether the staff were being looked after, that their well-being was being considered. And one of the first visits that we did, the manager who had been really struggling with the volume of demand that she was facing, said to the lead nurse, the day after the visit, "It's the first time I've slept through the night in weeks." So suddenly she felt the weight of the system wrapped around her, and kind of helping her through it, which was a brilliant thing we felt for these guys to feel, who had kind of been a little bit out on a limb, I guess. So the training and education was all around PPE, donning and doffing, infection prevention, health and safety, anything we could give them in terms of education, we offered them. Access to PPE, we ensured that the process for accessing council stocks of PPE was in place, and we also took some of our own to them. We arranged for the managers of the care homes to have access to our bank office as well, so that they could employ staff to fill the gaps. Some of these homes, their staffing had been decimated by the virus. So having access to our staff was a real bonus for them. We ensured they had a medical response where they needed it, be that GP, consultant or nurse. And these guys were they all expressed the fact that they no longer felt isolated. They very much appreciated us being a part of their daily activity. They understood that they were a part of the system and very much a part of the solution. Now, I've got a little film clip here for you guys, so I'm going to stop sharing and I'm going to ask John if he can play that for us. John, how are we doing with the video? Okay, I'm hitting A. Is there anybody out there? Can anyone hear me?
Ali, I'm just trying to link in with it at the moment. Just give me
Okay.
2 seconds, and
No, that's grand.
hopefully
Okay.
we will resolve
Thank you, John.
matters.
And thank you for
Okay,
bearing with us, guys. I do appreciate it.
won't be a mo here, I hope. Can you all see that? Yeah,
We can see it, John. Thank you.
you can see it. Yeah.
Yes.
Initially, there was a requirement because of COVID-19 to try and provide some extra support into care homes across Herefordshire, well, actually nationally. The programme was developed as an NHS offer from Ruth May, who's the Chief Nursing Officer. We would support with regards to, look to how they were managing with personal protective equipment, infection prevention issues. We'd look at, how they were managing with the welfare of their patients, of their residents. Staff welfare, just how they were managing. Was there anything that they needed? Was there anything that they wanted from us or any of our partnership organisations, just to help them through this a difficult time? So there was a very standardised format of how the training was delivered, and that followed through from super training to local trainer, and then the local trainers would take it out to the care homes and they would then deliver it to their staff on a train-the-trainer process. Herefordshire was, as an area, was really proactive in getting together. So the partnership organisation, your clinical commissioning groups, Taurus, Council, and Public Health were, along with Wye Valley Trust, were really proactive in getting together as a network to provide support for the care homes. And Wye Valley Trust was obviously seen as the perfect organisation to provide that practical aspect of support for the care homes. Each session involved training on hand washing, on donning PPE and doffing PPE, and physically going through the process to make sure that everybody had worked through it and understood it for themselves. I'd like to thank, obviously, the partnership organisations that we worked with, but also specifically to the senior nurses who supported with this project, and the temporary staffing department in Wye Valley Trust, who have supported some of the care homes with staff. I'd like to thank the infection control team for Wye Valley Trust. I'd also like to thank Tracy Bradley Vogue for helping provide the administrative support. Also the local council for providing some of the trainers and helped us roll out the programme, and also to the care homes themselves for welcoming us in and helping us roll out this education and embracing it. I'm very proud of the team that pulled it all together, and incredibly proud of Herefordshire as a county that, the multi-organisations that pulled together like this. Incredibly proud.
Thanks, John. Can I reshare my last slide if that's okay, guys? Can someone let me know whether that's shared?
Yes, it is.
Yep, good-o. Okay. And my last slide then, guys. Thank you so much for today. The conclusion to this session is that the organisations within our foundation groups are relatively small in NHS terms. Each of the organisations is between 3,000 and 4,000 staff, and we've all developed really strong and sustainable relationships within health and social care colleagues. And the stories that I've shared with you are ongoing. They haven't concluded. This activity is being put through into winter planning. I'm sure these are the stories that you're all talking about. And so with the aim that these things become business as usual, and that this is our model of play as we move forward. There's no kind of miraculous kind of magical moment here. This is about collaboration, communication, and consideration, genuinely at the heart of these stories that I've shared with you. Our patients and staff and all of our partners and our organisations have all benefited from these new ways of working, and there really is no going back. Thank you so much for your time today.
Great job, Ali. Great job. And if anybody would like to ask some questions, do please use the chat facility. We've got about 4 or 5 minutes before this session closes. So if you do have questions for Ali, or indeed for me in my role as technical guru for the profound success I've enjoyed in actually managing to broadcast a video, do please ask in the chat sections. Ali, they're all so overwhelmed that most have been struck up by the raw brilliance of your presentation, I think.
Good-o. Thank you so much. I'm just going to take that and run.